Hello, everyone. This is our briefing that we're going to do that we've been doing every day. Just like every day, it seems like there's just more and more to report, and I'm glad to be able to do that with you. I want to start off with the very thing that I hate the worst, and I know we're doing good as a state, but we've lost another individual. We lost a lady that's 89 years old, and she was at our Sundale nursing home, and that's our fifth death. It's now 5 too many. I just want to urge every one of you to keep this lady and keep this family in your thoughts and prayers, as Kathy and I will surely be doing, and so I just hate it, and this is a tough thing, but we're as West Virginia, we're trending very, very well, and we're surely trying with all in us to do everything we possibly can, but this is still a very, very sad event for the entire family, so please keep them in your thoughts and prayers. Along those lines, I want to tell you just this, is tomorrow, we're going to have to go later in the day. We've set our briefing for 4 o'clock, and the reason for that, and I want to just do this because this individual and I grew up together, and we were best friends all throughout all life and everything. But very tragically, Jeff Lilly, who is, like I said, best friend forever, they found him where he'd passed away from a massive heart attack in his sleep. And Jeff, like I said, we went to school together, and I especially hate it in lots of different ways. His dad was a good friend too, and we lost his dad, and he was actually hunting with me and had a massive heart attack. And I thank goodness that I just had a CPR class, and I tried every way in the world, but we did lose him. But I'm really thankful for those classes, and urge everybody on the planet to take those classes, because I really probably would have kicked myself for my entire life if I hadn't known what to do. But please keep Jeff Lilly, and what a wonderful man, just a kind and just a wonderful man that loved to laugh. And just think about him and his prayer and his family in your thoughts and prayers. Please do. I got to read a little bit to you now, but. Today, I am signing an executive order to mandate that all private and public golf courses take additional steps to ensure proper social distancing. Now, what we're going to do in this executive order is we're going to compel the individuals that are playing golf to ride one to a cart unless they reside together. We're also going to take additional measures to make sure that we keep the social distancing going on there, and this is just another heads up that people have given us, that people, we're trying to keep our outdoor spaces open, but people are telling us that, people are not complying with the social distancing, and so therefore we're issuing another executive order. We're also adding to that executive order, the allowance of the municipalities to hold their elections on the same date as the West Virginia primary, June the 9th, 2020 now. And I just want to say this statement, and of course I think you know this in every way, just the addition of stuff like this golf course stuff. I'm not trying to hassle anybody. All I'm trying to do is keep you safe, and keep all of us safe, and keep us going in the right trend line, and minimize me having to come here and announce another death. So really, let's continue to try to comply. I know you're doing great work. The trend line shows you're doing great work, but we can always do better. This is a really neat announcement that I'm really proud of and everything, but right here in the Kanawha Valley, right here, we now have a whole government effort together, and that's so important. I mean, it's so important. not only at this time, but at all times. It's really important. And a lot of times agencies just don't pull the rope together. But right here, we've got the National Guard, the DHHR, Homeland Security, the state police, and FEMA all going together to make this St. Francis Hospital an alternative care facility in order, if we have a surge capacity, in this terrible virus. So all these agencies are working together. I'm really, really proud of them, and I'm very thankful to the Thomas Health Systems. And they'll offer up to 95 beds at St. Francis for an overflow from the COVID-19 virus and everything, if we need that. And again, I emphasize to all those agencies my thanks for them working together. They're doing great, great work. And everybody's all in as far as moving equipment and doing all the stuff to be prepared. And God forbid, I hope and pray we don't need it, but we're just trying to be prepared if we need it. And I sincerely, again, thank the Thomas Health Systems. But thank you so much, and we appreciate it, and we're going to keep on going. Now, this primarily is an announcement to all of our seniors. And basically, it is an announcement urging our taxpayers to be on the lookout for scam artists and scam attempts. The IRS and the West Virginia State Tax Department are urging all of our people, especially our seniors, to be on the lookout for this. And I'm going to read you just this. The IRS and the State Tax Department will not call you asking to verify or provide your financial information in order to receive a quicker refund or an economic impact payment. Now, do you understand what I'm saying? And to make it perfectly clear is the IRS and the State Tax Department will not call you and ask you to verify, to provide additional financial information or whatever it may be. So if you get one of those calls, please call us, call your authorities, whatever, but do not give up your information. And please also be wary of emails, text messages, websites, and social media attempts to request money or personal information. And for more information on this, you can look right at our webpage right now or this posting. And Jordan, I'm going to wait on you just a second to put that up. Okay, and I'm going to give y'all just a second to be able to look at that. And again, we do have knowledge of many people attempting this scam and preying on our elderly primarily, and we sure don't need this at this time. So I'm going to go to, I guess, my next to last thing, and that is, again, to urge everyone to take 5 minutes and respond to the census information that you're getting. Go online and fill it out right now, please. And you can fill it out by going right here, or you can call 1-844-330-2020. And the census will be also mailing forms to the household that have not responded. Your response again is vital, because we got to be counted, because as we're counted, more and more and more monies are going to flow to us from the federal government. So please be counted. This is not something you need to shy away from. The last go round on the census, we had a tremendous amount of people that were not counted, and that really hurts us, and it hurts us for a long time. I think they do this once every 10 years, and it hurts us for a long time, so please be counted. Now, I guess the last thing I had to report is just this, and it is, and Dr. Clay Marsh is going to jump in here in just a second, but on our webpage, on our dashboard, we've got lots and lots of information. If you'll, I guess, Jordan, if you want to put that up now, and then I'll go, with our primary dashboard. Okay, that's not really the slide I'm looking for, but, I'm looking to start on the left and go all the way across. Okay, well, I'll just read, okay? Here, and then you can see it in just a second, or you can go and look at our DHHR, dashboard. But yesterday, we only had 2 positive tests come in. Well, it's like you could dance in the streets about that and everything and say, unbelievable, fantastic, unbelievable. But the problem was we only really had about, only about 35 test results that came in. And so as, we can't get excited at all about 2, and we're updating now twice a day. And so the good part about it is just this, is we are still trending at positive tests versus total tests taken. We're still trending at 3.76%, which is just terrific. This national average, get this, is 19.03%. We're trending at 3.76%. That's great. As far as our surrounding states, Virginia's at 11.89. Tennessee is at 7.7. Ohio is at 9.65. Kentucky is at 6.2. And Maryland is at 14.3. So we're basically half of the next closest state, and we're much, 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 much higher. We're 1/6 of the national average. So that part's good. From the standpoint of a lot of people were wondering, well, how many tests are taken? The bottom line is this, per percentage of our population that have been tested, we are at 7.23, and the national average of tests taken is at 67.6, or 6.76 rather. So we're trending higher on the number of tests taken. The only state around us anywhere that we are not significantly higher on the amount of tests taken is Pennsylvania. We're at 7.23 and they're at 7.69. So the long and the short of it is we're really taking a lot of tests. Our positives are still really low. You've got a dashboard that you can follow now very, very closely. I would not be skewed in your thoughts about the number of positives that came in yesterday, because we just didn't get many test results in yesterday. And the only other thing I would add is this updates now twice a day, and the next update will be at 5 o'clock today. And at this time, I'm going to turn the mic over to Clay Marsh, and he's going to update you on all the virus patients that we have and all the good stuff that is going on. And you'll see real quickly that the overwhelming majority of these people are on home isolation, but I'm not going to steal the stage on Clay. I'm going to let Dr. Marsh take it from there.
Well, thank you, Governor. It's great to be with everybody again. And one of the things that we have been asked repeatedly is to make sure that we are able to show the data on not only our cumulative numbers that the governor just went over. We're doing well on the number of people per capita we're testing, which is great. And that's really to many people's hard work at DHHR and others. Our mortality rate is lower than national average, which is now about 3.4, and lower than worldwide, which is 5.5%. We're approaching 1%. We know that we have done a lot of important things, and our citizens have done a lot of important things to make sure that we are doing uh, the suppression strategies to reduce the virus spread. We've talked a lot about the speed of the spread of the virus, and ultimately by staying at home and staying physically distanced from each other, we know that we can reduce that spread, which is important. Many people on social media and people that live in West Virginia and media members have asked also for some details on how people that have tested COVID positive are doing. So if we could show the slide of the breakdown, and this is really done by the very hard work and commitment of our National Guards folks. So this is John Wiles and the team, and I want to give credit to him and them, and certainly General Hoyer and the excellence of the Guard. But this is done by going to each county health officer and each county to get these data. And we will show this data on the DHHR website as well. But just to go over some of the statistics, and I think that one of the issues that we need to deal with right up front is that depending on where you're getting this information reported from, there may be some subtle differences in some of the numbers. The Hospital Association may show some subtly different numbers the way they're counting than the counties are. But we wanted to get this out so people could see this and could benefit from understanding this. And I'm going to go over the chart on the right really briefly, but of the 504 positive COVID positive people in the state, we have active case investigation on 442, which is about 88%. Of those 442 people, 26 or 5.9% are in the ICU on ventilators. 13 are in the ICU off ventilators, which is 2.9%. On the hospital floor, 40 people of that 442, which is 9%. Total in the hospital on the floor and in the ICU is about 18%, which is what we also saw in China. Home isolation is 82% or 363 people. And we have a category here called recovered. And that is a challenging definition. CDC has come up with its own definition. This is people that have left follow-up by the county health officer. So these are people out of quarantine and out of observation. And so we'll put an asterisk there to define what we mean by that. We've had 5 people that died, and this is now all 55 counties reporting. To the left are the 5 highest reporting counties with the status on a cumulative basis of the people in those counties. So this data is going to be shown on the DHHR website. And I think Dr. Slimp may talk about some further data that we will dive into the case studies of some of these people over time, but we wanted to make sure that we display that. The other issue that the governor talked about is that we are now refreshing our data twice a day. And this is something new so that we can become more current to allow people who have media cycles or people that are just avid followers of the statistics to be able to get on and stay current with what they're seeking. And we believe that by doing this, that we will eventually start to catch up because the county may report different than the state because many of these results come to the county people first and then get reported up to the state. So we're looking to try to create a consistent updating of that information. And some of the testing, as we've talked about in the news conferences, the briefings, and also on social media, they lag behind because some of the private companies that take some of these tests, it can take as long as 7 days to get some of the results back. So the data that you'll see on a certain day may not just reflect the results that came back in the last 24 hours. They can also include some of the results that come back for these tests that have been done several days ago. And on the DHHR website, the data is displayed so that you can see on the date that the test was taken, how the positives and negatives have been. And we're going to add a category, and we're trying to get this all straightened out, of what the results are by day. So these may include tests that have been taken for several days ago. And we're really doing this to try to give people a variety of ways to look at information so that they will feel informed as we do, and be able to understand some of the decision making and what is driving it. I'd like to say two more things and then I'll stop. So number one is that we're doing really well, and our peak date of the COVID surge is predicted by at least the University of Washington model to be on April 15th. And our projected mortality rate's gone down, as well as the surge numbers. We have done a great job as a state in flattening the curve here in West Virginia, and every citizen should feel proud of that. But I think we should recognize, just like if you're in a football game and you go up 2-touchdown lead in the first quarter, that doesn't mean the game is over. And so this problem that we're having, this pandemic that we're seeing all over the world, we're approaching the first peak, and that's fantastic. And we want to give all of our citizens a tremendous amount of credit for doing the right thing, slowing down the growth, flattening the curve, helping make sure that we don't surge over our healthcare assets. But this is an evolution of how we will deal with COVID-19, that we're going to have to stay diligent and vigilant and not be complacent, because we want to get through the first part, and that's our important focus right now. But we also will then have to understand, based on the experience in other countries and guidance that we get from the Centers for Disease Control and others, about how we start to reactivate, our world in a safe way and our state in a safe way. So I think it's important, as we are celebrating Holy Week this week for many of us, with Easter this weekend, that we maintain our commitment to physical distancing and staying at home. Certainly, we want people to celebrate in a way that's meaningful to you and to worship. That is such an important element for all of us, for our hope and for our futures. But we implore you to continue to do the things you're doing now, which protects all of us, protects our frontline workers, our first responders, our essential workers, our healthcare workers, as well as protects you and your family. The last thing I will say is that we also know that many other parts of our workforce are very nervous and worried about personal protective equipment and some of the things that we are recommending. And so we will make sure that we're expanding our guidance to businesses and to other essential workers, so that we make sure that everybody feels that they have the appropriate training and the appropriate protective equipment, so that they can safely do the job that is serving all of us, that we are so grateful for. But we want to make sure that they feel equally as safe as we hope to help our healthcare frontline workers, our first responders, to do as well. So with that, I thank you, Governor, for the opportunity to be part of this tremendous team, and I will cede the floor back again.
Thank you, Dr. Marsh. And we are very, very, very lucky to have you on this team. I'll promise you that, sir.
Okay, thank you, Dr. Marsh. Let's go now to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 560 National Guard men and women on duty. To give you just a highlight, over the past 26 days, they have conducted over 280 missions in support of this effort. As was mentioned yesterday, our efforts with Workforce West Virginia continue. We're up to 21 of 30 National Guardsmen who will be on duty supporting that effort. Today at 7 o'clock, a second call center went online at West Virginia University, and the third call center will be going online soon. And we are looking at the potential of a fourth call center now to make sure we disperse our assets effectively. We'll begin receiving support from the West Virginia State Police personnel as well on that mission. Also, at the direction of Governor Justice, we have a team from the Office of Technology, Workforce West Virginia, and the National Guard Technology Office looking at additional technologies and software that will be used to help improve the call center, as well as improve the efficiency of claims processing. We'll provide you more update on that next week. In addition, our task force that's doing training and PPE support to retailers and other businesses yesterday conducted missions at 49 locations. Today, they're conducting training at 37 locations and will be continuing to work throughout the next several days to support as many missions as possible. In addition to that, that same organization has provided lane assistance training for drive-through testing in Grafton, Huntington, Weston, Brooke County. Will be coming on and expanding in Mingo County and Wyoming County. And next week, we'll add support to Logan County, to Williamson, Hampshire County, and a second lane in Cabell County. So we continue to ramp up our efforts to support our DHHR partners and our local health partners in testing. In addition, over the past 24 hours, 417 family food boxes were processed at the Huntington Food Bank, and 2,086 were processed at Gasaway with the assistance of the West Virginia National Guard, the food banks, the VOAD team, the volunteers, and I want to, on behalf of the governor, thank VOAD, our food banks, those who donate to our food banks for all the great work they're doing to help support our families in need at this time. In addition, on the logistics side, we've provided additional support to the Eastern Panhandle, Morgan, Jefferson, and Berkeley County with PPE support that will be going out today. And we're establishing 2 additional sustainment sites, one in the Eastern Panhandle and one in North Central West Virginia, to better serve PPE distribution, particularly when we hit our peak time. Last couple of items I want to present on the information and analytics side. In support of our DHHR partners, our local health partners, yesterday we supported 153 engagements related to contact tracing. In addition to that, one of our doctors, Dr. Eubner, and a team supported the Wayne County nursing home with additional testing related to that particular incident. And I want to thank Dr. Deb Keister from Marshall University and our 55 county health directors, along with the Hospital Association and the long-term care facilities, for their great support and partnership as we pull this important data together to better manage this event. And last, on behalf of all the 6,400 guardsmen and particularly our recruiters, Governor, we want to thank you for the great shout out yesterday about joining the West Virginia National Guard. We hope it means our recruiting will go up exponentially in the next several days. Thank you.
Okay, thank you. Next, let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. I will echo what the governor said about cooperation and everyone working together. It's a tremendous team, and our partners out in the communities, whether they be acute care, long-term care, or others, have been unbelievable in this pandemic. I especially want to thank Dan Laufer and Thomas Health Systems for stepping up and being a terrific partner. In the event we have a surge, we have plans for that. We're very hopeful we do not need to utilize St. Francis to a great degree, but we're going to make sure citizens have the care they need and the services they need in the event that would happen. So we signed that MOU yesterday, and again, thank you, Dan Laufer and St. Francis. Other than that, I just want to mention that we're working hard in many communities in the state. There are a lot of, we're dealing with a lot of questions that really go back to social media, and questions that we end up, after investigating, have no basis. We're trying to report, as everyone has indicated, on the website, trying to make that more accurate and to provide more information on the website in terms of what's needed for folks to understand where we are, and for the public to have a good idea of this pandemic and how we're going moving forward with it. So West Virginia looks great, and it's because our governor has given us the leadership to help everyone understand what's needed, and the public has stepped up and done that. So thank you very much. Take care of yourself. Be safe. Thank our healthcare workers again, and take care of your families, please. Thank you.
Good afternoon. Public health continues to take the lead at local and state levels in terms of the case and outbreak investigation work that's underway, and we appreciate the partnership of so many in doing that work. It is challenging and interesting, and I know our local health departments have been very active and busy with that, along with many community partners as well. Certainly also lots of activity around healthcare provider communications and support. We look forward to continuing that work. I wanted to do a little bit of a seasonal note today. And Dr. Marsh mentioned this, but I think our community and faith-based organizations play such a critical role in preventing the spread of COVID-19, especially among our elderly and high-risk populations. They play a critical role in keeping people connected during a challenging time, and a role in really supporting communities and the families and the challenges that all of our communities are undergoing. So given the holidays, both this week with Easter and Passover, as well as later in the month with Islamic religious holidays, we've had some questions around gatherings related to these events. And so I think what's really important to say is that at times like now, when we've got widespread social distancing and community mitigation recommendations out there and really are trying to adhere to that very, very tightly and very broadly, that we really have to say that traditional in-person worship or fellowship or gathering activities really should not be held. We really are encouraging and absolutely support our alternative approaches that maintain those recommended prevention practices. So we're hearing places do all kinds of things from phone-based to online delivery of services and meetings, to drive-in worship using low-frequency radio communications, lots of ways to connect in alternative ways. So I think what's most important there is to really make sure that all of our faith-based organizations and communities stay connected, to stay a faith-based community, to take care of each other and the broader community, but to do so in safe, effective, and creative ways. So just some reminders around this time. Thanks.
All right, thank you both. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Jordan Hatfield with the Register-Herald.
Yes, can you hear me?
Yes, we can.
Okay, this is Jordan Hatfield with the Register-Herald. I'm actually asking this question on behalf of my colleague, Aaron Beck, who wasn't able to tune in today. Advocates for victims of domestic violence say that domestic violence is worse during periods of isolation like this, and that it's difficult for victims to call for help when they are isolated with their partner. And because shelters can be crowded settings, they are very high risk. But they say they lack testing for their workers, enough disinfecting supplies and masks and face shields. So do you plan to provide additional help for shelters, and when? And what will you do to help victims isolated with their partners?
Jordan, this is the governor, but Jordan, you're correct in that at times like this, things can fall through the cracks. And from the standpoint of domestic violence and everything, we don't want anything falling through the cracks. And we're trying to staunch that up in every way. I'd like for our medical community, primarily Bill Crouch, to jump in and he can tell you more. But we're absolutely aware of exactly what you're saying. And in times like this, that is something that could very well fall through the cracks. And we don't want domestic violence anywhere, anyway. And so, Bill, if you could jump in.
Yes, Governor, thank you. Our Bureau of Children and Families is in communication with those community providers out there that provide assistance to individuals who need that help, and we have stepped up that communication. We understand that there's going to be more incidents in this type of situation. Individuals are at home, and it's difficult to get out and away from those situations. We have similar situations and concerns with our children and with elderly. So absolutely, we're very focused on that, and we want to make sure that we're there if folks need us. We may have a number we can put up on that too. If we don't have that today, we'll have that tomorrow.
All right, thanks. Next, let's go to Dave Mistich with West Virginia Public Broadcasting.
Hi, folks. Governor Justice, several groups now have asked you to issue an executive order to reduce the Division of Correction and Rehabilitation's inmate population and to provide transitional housing for those released. What would have to happen for you to issue that order as the state's facilities are still overcrowded?
Yeah, Brian. I think Brian's got to answer that.
Dave, those groups obviously took that issue to court, and the judge in federal court just a few days ago found that the department had adequate protections in place and had a plan for that. The alternative to what those groups are arguing is to release violent offenders, sexual predators, etc. And at this time, we believe the Department of Corrections has the matter in hand and is able to take care of those prisoners. I'll note that as of today, we still do not have a positive within our correctional facilities. And again, they are doing everything they can to ensure that if anybody is infected, they'll be properly quarantined and taken care of. Our law enforcement community has spoken very clearly on this. They don't think now is the time to put people back on our streets that pose a risk to our citizens.
And let me follow up on that. You know, first of all, let me bulletize it. We've not had a positive yet in any of our correction facilities. That's really a major plus. So evidently we're doing a lot of good things, but at the same time, you know, we absolutely don't want to put out on our streets, you know, violent criminals and just cause our, you know, our public to be preyed upon even in a worse way, and we're not going to do that. And so, but as we move forward, if our corrections people recommend to me that there's a certain sector of our inmates and everything that are nonviolent and whatever like that we can go ahead and release, I'll be glad to do so.
Okay, thanks, Dave. Next, let's go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. There were, again, eye-popping weekly figures for national unemployment numbers today. Is it possible to get an update on the sheer number of initial West Virginia unemployment claims?
That's not come to me yet, Brad. But I can tell you what has come to me is just the fact that we've got all these additional people that, you know, have come in from the Guard and workforce. You know, West Virginia is doing a great job as far as processing claims. And the other flip side of it is just this: just stay tuned to the government stimulus packages that are coming, because many of those people that are now, you know, have submitted unemployment claims will be getting a paycheck from their employers and coming off of unemployment. So as the numbers, I'm sure up till this point in time, have grown, I'd tell you that the numbers are going to begin to decrease pretty rapidly.
Okay, thanks, Brad. Next, let's go to Dustin with WDTV.
What?
Yeah, Governor, so yesterday you added Marion County to that executive order, and here in North Central West Virginia, we have a ton of cases. It's one of the bigger chunks where the cases are. When we have this upcoming surge, are we thinking about repurposing Fairmont Regional since it's such a centralized location up here?
I've been an advocate of that from day one. And we've got a lot of people that are working on Fairmont Regional because without any question whatsoever, in my opinion, I've been an advocate of that, if you'll go back, probably now almost a month ago, to be able to get equipment and to be able to use Fairmont Regional in case of a surge or in case of an outbreak, just like what we're talking about. You know, I would defer again to our healthcare people. Maybe Dr. Marsh could give you some more insight.
So that's a great question. And certainly we're working with all of our healthcare hospitals and larger providers, because we believe that they will be critical to stay operational if indeed we do get a surge. And as we know that the real problem around the world including Italy, and we're seeing that here in the United States as well, is having the critical care capabilities overwhelmed, so that you can't take care of people who develop respiratory breathing problems with the COVID virus and other critical care problems too, like heart attacks or severe strokes or other illnesses like that that can be acute, or traumas, car wrecks, etc. So we are working closely with the hospitals, we're working with FEMA, we're working with the Army Corps of Engineers, and we're looking at all the options, and we're trying to do that in a way that we can expand the capability of the hospitals to be able to take care of people that are local to them, because it's easier to flex your number of your staff and your equipment and your capabilities locally than it is to try to do it at a distance. But we're certainly looking at Fairmont and St. Francis, which Secretary Crouch talked about, as extended surge opportunities for us as we go forward.
Hey, let me add just one other thing to that too. You know, we're going through the period where WVU is transitioning into the Fairmont facility and everything, and you can just imagine what this virus, this terrible, monster that invaded us, has done to everyone. As far as that transition would have been seamless, but as that transition is becoming, everybody's all hands on deck at the bigger facilities and everything to make sure that we can handle a potential surge. But no one has backed away from the need of the Fairmont Regional Hospital and the need to get that staffed in case we would have some level of surge. So we're still, the Fairmont Regional Hospital is still absolutely at play, and we're working it every way, but you can just imagine all the stuff that's going on to cause us difficulties there as well.
All right, thank you. Next, let's go to Jackie with WVVA.
Thank you. Governor Justice, Canal County announced a hero's pay hike to essential workers. Is that something you're considering for the entire state or looking into or anything?
I'm sorry, I just couldn't hear it. You got to forgive me. Somebody tell me what the question was.
I believe she's asking about hero pay for first responders.
Well, I've gotten this question several different times. And I try as hard as I possibly can not to pass off the question. We're working it. I would say, first and foremost, I am an advocate to try to help these people any way and every way we possibly can, because they are doing heroic work beyond belief, and they're putting their lives, they're putting their families all on the line for all of us. And if we could reward them and make life just a little bit easier and help them, I'm in. I'm all in. And we're working it. And I would say this is the second day that I've gotten a question in regard to that. The first day was yesterday in that I got the question, from either Amanda Barron or Kenny Bass, and then the question today. And to me, if you give me the question 2 days and I don't have an answer, I'm going to have an answer when I come in here tomorrow.
All right, thank you, Jackie. Next, let's go to David Beard with the Dominion Post.
Hi, David Beard. Dr. Marsh mentioned that it can take up to 7 days for the private labs to return results back to the state. And I get emails just about every day from people who ask me, they don't understand the reason for the lag, and I don't know how to give them a coherent answer. Could someone explain that for me, why that lag occurs?
Dr. Marsh, this is you.
I'll give the first thing. I think Dr. Slimp has some to add too. Part, David, of what we have committed to do is to test as many of our citizens as we possibly can. And in order to expand testing, from the state lab, from the CDC initially to the state lab, and then to the university and large hospital laboratories like CAMC, WV Medicine, Marshall, we had the opportunity to have private lab vendors like LabCorp and Quest to come and help us accelerate and increase capacity to test more people. They were so overwhelmed with the response, not only in West Virginia, but around the country, that they started getting behind and they started to have trouble keeping up with the demand. So they've opened additional laboratories and have more capacity to get those done faster today than they used to. They're trying to move some of these new places closer to areas of different states that they can get things back and forth to, but they are catching up. And there's been, I think, a reduced amount of time between the time that the samples obtained and the results back again. But certainly if we could try to get all of that testing inside the state, then we would be able to turn those results over much faster and give people the answer to their to the question of whether they're positive or negative faster. The other thing I will say is from the great work of the federal government, there is a new technique that's a rapid testing technique that can be done in 5 minutes for positives and 13 minutes for negatives from Abbott Diagnostics, from Abbott Laboratories. And each state got an allocation of these, and Dr. Slimp is using this technology now in the state's lab to be able to do things quickly and outbreaks and to do case investigations. So I think as that becomes more, as we have more supplies and more capacity there, that will also start to change the timing of our ability to give our citizens an answer more rapidly. And Dr. Slimp, I'll turn it over to you for any other comments.
Sure. I think we have to remember that it's only been in the last 6 to 8 weeks that that laboratory testing has expanded from having a testing that has been solely at CDC essentially to then to state laboratories. And the state lab is meant to really do the public health aspect of those investigations, but for a long time needed to be the clinical diagnostic laboratory for the state. And then now we are expanding out to the broader clinical diagnostic laboratory system to build that. And so companies from around the world developed capacities to develop a test that truly was not here on a virus 3 to 4 months ago. So this has been expanding rapidly. The clinical diagnostic laboratory system is evolving and emerging. We do have several facilities around the state that have their ability to do that testing. Some of them can do that quick turnaround, the WVUs and the CAMCs and others that have got that ability. Others are primed to do so, but the challenge has been national shortage of reagents. And so many are backlogged from that angle. The private sector, the Quest and the LabCorp, as Dr. Marsh mentioned, and these are normal routine diagnostic clinical laboratories that facilities around the state have contracts with all the time, and they just added on COVID-19. They were just so overwhelmed nationally that they got backlogged. And so that's where we were seeing literally 7-day, 10-day, 12-day turnaround times sometimes with those. They are getting better. As Dr. Marsh mentioned, they've been building out different laboratories to do that work, location in different states, ramping that up. We're starting to see that decrease somewhat, but still is behind with that. The Abbott tests are exciting to have evolved. And so we are going to be, we have received a very small amount of that right now that we actually were using to back up one of the clinical laboratories at the hospital yesterday when one of their facilities was down, one of their machines was down. We are going to be getting more supplies to do that. And so those we are hoping to come in the short order, but we have to wait and see till they get here. But then we look forward. Our goal with that is to expand, our primary goal with that, there's twofold. One is to expand the regional availability of more rapid turnaround time for testing, where there's not that right now, to make sure we place some equipment there that can provide that. And then the second objective with that would be to use more on a mobile basis related to outbreak investigation, special populations that we really need to have a quick response on, et cetera. So there's good thoughts around a great new asset and how to implement it.
All right, thanks. We have time for one more question. Let's go to Kenny Bass with WCHS.
Yes, Governor Constellium near Ravenswood in Jackson County now has 7 confirmed COVID-19 positives. That's 1/3 of the entire total of Jackson County. I know it's a subjective number, but what number needs to be hit for you to consider somewhere a hotspot, and then for extra measures or special measures to be instituted at a plant like Constellium, which has 1,000 workers working in close proximity and appears to have at least a small outbreak of positive results?
Well, Kenny, the best way I can answer that is, first and foremost, I would defer to our medical community because they're watching it, and they're watching it just as I'm watching it, but they're watching it with really keen eyes. There may very well be a situation right there in Jackson County where we do have a hot spot, and they're all over that. They've already advised me of what's going on there, and but I will defer to the experts on this one, and when they tell me that we've got a real issue, I'll act on it. But I don't want, like I said before, I don't want to just move to a statewide situation like we now have on the 7 counties, because I think when you do that, to just tell it like it is, I think it waters down the effect of us addressing what the true hot spots are. And if we water down and people become lax, we're going to have a bigger problem. And so we want to stay right. When we really know it's a hot spot, we'll act, and I'll act on the advice of the experts.
All right, Governor, back to you.
Well, let me end up today by just saying this, and I think it was Jordan, in the Beckley paper for Aaron. And if I misspoke on Jordan, I'm not very good on names, so please forgive me. But you brought up the what I would classify, for first responders or those that are on the front line, some level of hero type pay. I owe you an answer to that, and I owe you an answer to that tomorrow. And so all of my people better be on red alert, because that's the first thing I'm going to ask when we leave here, is to see if there's a way to do it, because I would be a real advocate, because these people are doing so much for us, it's unbelievable. And I think, Brad, you asked about the total number of submitted claims. I think the total number now is somewhere around 113,000. We've got the 3rd call center that's going online tonight, by my direction, and what General Hoyer and the Guard is doing to staunch up, Workforce West Virginia. Today, we had a total, yesterday, we had a total number of claims that came in of 5,400. We processed 4,200 claims yesterday. We're still losing a little bit of ground and everything on certain days. Certain days we're doing terrific. We're training more people right now that will be coming online that will be able to process claims and not just answer phones. And so with that being said, here's the thing I guess that all of us should try to get our arms around. It's just this, is if we had 5,400 claims come in a 30-day month, you're talking about well in excess of 150,000 claims. And in a typical month, we had 3. And so it is a monumental task to get everything out and get everything out the door. It's a nationwide problem, but West Virginia is going to some way, somehow lead the way. We got behind. We have absolutely, had great support from the National Guard, and a lot of people step up. But I want West Virginia leading the way. I don't want to be able to sit here and tell you we're bebopping along with what the nation's doing. I mean, this has been our effort to be first, and we want to be first and foremost in just this too. I'd like to, let me just think if I've got anything else here to report. Well, I've got just this. and that is, when you see these numbers, now I'm talking to the people. I'm talking directly to the households. When you see these numbers come out, it's easy to look and say, well, dag, West Virginia's doing really good. And it's easy to relax just a little bit. Our National Guard with the DHHR and all the efforts as far as making all these wonderful stat sheets and providing information from all the hospitals and everything, they're working their tail off in every way, and we thank them. We thank them. But I'm telling you, our people, I'm telling all of us, just remember just this. We are the highest risk state in the country. The highest risk state of all. We have the people that are the most susceptible, the elderly or the people with diabetes or COPD or whatever. We are the highest risk of all. And we keep pumping out the numbers that absolutely show us that doing the best of anybody. Don't go asleep at the switch. Stay the course. Let's all run across this finish line together. We're going to save so many lives if we do that. And absolutely, we're going to be so proud of West Virginia as I am so proud of you right now. So for all the healthcare and all the first responders, all the people, all of our police, everyone, the Guard, everybody that's on the front lines, we thank you. We thank you in every way. I am proud of you beyond belief, and I mean it just from the bottom of my heart. Let's all run across this finish line together. Stay the course. Thank you so much.